Hi, and welcome back to the Dr. Ramsey Show. I am so excited to be back after my total hip replacement. I'm really enjoying, seeing my patients again and being up on my feet again. I took the first week off. The narcotics were pretty hard on my body, and I do have a medical card for my hip pain, so I was using medical marijuana to treat my pain. And the last time I took it was Sunday night before I came back on Monday. The entire week, Monday through Friday, I was slurring my words with patients. There was no narcotics in my system. There was no medical marijuana in my system at all. I couldn't work like that. And so what I realized, and it wasn't me who figured this out, is that my brain was very dehydrated because I was just laying in bed, doing my exercises, but resting and not drinking a lot of water because I didn't want to have to get up and use the restroom so frequently. So it was really an eye-opener for me that I could not articulate my R's and my S's. Thank God for Lily, my assistant. She helped me a lot with patients. But for all of you that I saw last week, I really want to genuinely apologize for that. I know that we were tracking each other and I just couldn't get my mouth to say the words I wanted to say. Even though I wasn't taking medication when I was treating you at all, I didn't need it. The type of pain when you have a hip surgery is like achiness. It's not real bad pain, but it's achy. It's heavy and, all the hardware is settling into your bones. And bones don't have a big blood supply to them at all. And therefore, bones can take a long time to heal. What did I do? I went into our hyperbaric oxygen chamber and through that because of the pressure and the 100% oxygen, it goes to the most inflamed body part. And I could actually feel it. It was a little bit achy. My bones were improving with the enhanced oxygen under pressure. What I wish I could have done, it was my plan, but it wasn't God's plan for me, was to do IVs as well, because IV therapy helps our body heal very quickly. We do IVs for a lot of reasons, but we do pre and post-op IV specifically to target clearing out our brain for anesthesia, helping the wound heal more quickly, prevents bruising, etc. I couldn't do them because all of my nurses were sick, all of them. So I didn't get an opportunity to do the IVs. Had I gotten to do them, I think my speech would have been just fine. I would have been very hydrated. In fact, my first day back, well, it wasn't my first day. It took me a few days to realize it was dehydration. But when I finally got my IV bags, my speech came back completely. So it was a really interesting trip for me. And again, I want to apologize to you that I saw last week. Thank you for your graciousness. The hormone therapy is extremely helpful for bone healing because as we age, our bones get weak and brittle. They don't have to. If we take estrogen, our bones are nice and strong till the end of our life. And I know I have really strong bones. Otherwise, the hardware would break my bone as they were hitting it into my thigh. So hormones are essential for healing. IV therapy is really essential for healing. I didn't get that. Hyperbaric oxygen does too. If you're like me and you want to get back on your feet quickly and see your patients, sooner than later, I want to always heal fast. I'm just mesmerized by what the body can do, how it does it. And I want to thank you again for accepting the new doctors in our office in my absence, because I was gone for 10 days and the offices ran very smoothly. So thank you for welcoming all the new doctors. Have a beautiful day. We'll see you soon. Bye-bye.